A preliminary outbreak investigation report that BBS obtained stated that symptoms began appearing between June 20 to 29, including cough, fever, sore throat, and diarrhea. Some cases rapidly progressed to acute respiratory distress syndrome and acute kidney injury requiring intensive care. The Health Ministry said that of the 230 trainees, over 140 who showed mild symptoms are undergoing appropriate treatment. Even the asymptomatic individuals from the same cohort are being treated. A doctor from the National Referral Hospital said the outbreak was alerted on Saturday after several cases were detected among the De-suup trainees. The doctor said 3 succumbed to illness because they were presented too late for any interventions.
They have presented to us during the immune phase of the disease, during which even if we give the most appropriate treatment at the right time, there is going to be minimal response out of it, because of which they went into severe form of disease in the form of acute respiratory distress syndrome, ARDS, and they also had hemoptysis.
She added that affected patients are being called in the capital at a designated center for treatment and are monitored by a dedicated health staff. The ministry mentioned in a notification that detection and surveillance activity will be continued to monitor and prevent further spread of the disease. Moreover, all health facilities nationwide have been alerted to ensure early detection and treatment of suspected cases. For now, the pond where the trainees were exposed to is suspected to be the source of the bacteria.
All the epidemiological and clinical links, it points towards contaminated water pond, which could be possibly contaminated with urine of rodents. So we have taken the water sample from that pond and we have sent it for further investigation. We will get more details as we get the reports of the test.
Leptospirosis is often spread through exposure to urine of infected animals from direct contact or from contact with soil or water contaminated by the urine. According to the Health Ministry, human-to-human transmission is extremely rare and the disease is not considered contagious between people under normal circumstances. The Royal Centre for Disease Control, along with regional hospital, tested samples to confirm the bacterial infection. For further confirmation, the ministry has sent the samples overseas and it will take at least 5 days to get the results. Officials confirmed that this is the only outbreak of leptospirosis in the country, though sporadic cases were reported in the past. 𝗁𝗂𝘂𝘂𝘀𝘶, PBS News.